Welcome back to Zero World 2016. I'm David Temple, and as you know, I love to talk, and I wanted to jump in here, but we brought in a super heavy hitter, Tony Angelini from AEGIS Communications, in order to interview some really fine gentlemen, James Klim, John West, and Dhaval Patel. So, Tony, it's all you.
Okay.
Tell us about AEGIS Communications.
Well, we are in the publishing business. Our company's 11 years old. Publish a few dental publications, Inside Dentistry, the Compendium, and a lab publication called Inside Dental Technologies. Of course, the business that we're in now is trying to engage, find new ways to engage to the audience. So within each one of those brands, we have several channels, whether they're newsletters, e-blast, webinars, constantly looking for ways to engage to our readers. So it's been a very fascinating business.
How about our gentlemen who have much to say? I know, especially this character right here.
No. I'm an endodontist. We're in our own little corner down in the tunnel, nice and safe. The rest of the world can go on. I was interested in your inside. How about we start inside roots? But I will.
Will you help out a little bit?
But I will just, I will say what a privilege it is to witness this merger. Really, honestly, CIROWORLD was not part of my dream state recently, but endodontists, like I said, have always been the potential of being the weakest link, and yet we've stayed pretty much in our own little corner, and it's time to participate and fully go through the thought process of treatment, diagnosis and treatment planning. I understand dentists would rather whittle on teeth than an implant if possible. And so that's going to be a great thing. And to witness this is a real privilege for me, and happy to be here.
Well, Dr. West is so respected in the marketplace. I've been in the marketplace 29 years. I'm embarrassed to say that it's the first time we've met. So we need to talk a little bit later on.
Both ways.
Dave, I want to thank Dentsply, Sirona for the opportunity, first of all. I also want to thank my guest for, thank you in advance, actually, for tolerating some of my questions. So, Dave, what I've done, trying to be as organized as possible in the little time that we have, I've developed a series of questions for each specific person. So when I ask a question to Dr. Klim, Dr. Patel, you want to participate, please do so.
Absolutely.
Does that work for you, Dave?
Perfect.
You're the boss, so.
You take it and run with it, babe.
Well, I want to ask my first series of questions to Dr. Klim, if I may.
Yeah.
You are an accredited AACD member. I'm interested to find out how you've incorporated some of those principles into CIROWORLD utilization.
The early journeys were interesting because I had this sense of wanting more control. And I've worked with great laboratories, and I've taught ceramics. And I was looking for this bridge. In fact, one of my good ceramic friends told me you should get into CAD/CAM. This was about 12 years ago.
Okay.
And since then, it's a new world. For instance, if you look at materials today, most materials are being driven around CAD/CAM and digital dentistry. So it's a natural. So my flow into this journey is a lot more exciting now because I can see a lot of users reaching a really high bar because a lot of the technology and the way the software thinks, if we set it up right, we're going to get exceptional results with exceptional materials. So it raises the batting score for a lot of people.
Yeah.
But I'm glad to be in it because I think the AECD and that cloud for me gave me the ability to view what I wanted. And if you can see what you want with this technology, you can get it.
Yeah. It seems like the comfort level is certainly growing. What do you think for someone that's considering purchasing, getting involved in digital dentistry? Where do they start? Do you just jump in? Do you feel like that dentist needs a technology plan? How do you start the process?
Well, I know we practice, and my view on this would be is your center command system, particularly with the Sirona system, is the OmniCam. Because with that, you have the ability to capture good digital data. And with that data, we can use it in a lot of different formats. Study models, new patient exams, orthodontic appliances, sleep appliances. Obviously, we think of restorative dentistry, but it's also the bread and butter of restorative dentistry. So
Sure.
that platform allows you to reach out and use that in other dimensions of the digital platform.
Okay. With the introduction of Sirona's zirconia as well as Speedfire, I think they launched that in the Chicago Midwinter meeting this past February. Has this material and this technology allowed you greater chairside capabilities?
Well, I was part of that investigative team here with the Speedfire, and I watch a lot of the world, like I watch Europe quite a bit, and I see a big move into zirconia. Now, we know the functionality and the ease to make it is almost easier than any other material I've ever used.
Okay.
Now we're working on the aesthetic side, and we definitely are coming through with that. So I see that as a major player in the future of dentistry for quite a few years.
Okay.
And the Speedfire system is a game changer because of the way it centers.
Yeah. Very user-friendly.
Very user-friendly. We're talking about 15 minutes versus 9 hours of centering.
Really?
Yeah, and that's the induction oven. So as the materials are integrating into this system, the ease of finish is nice because we mill it with a carbide burr, and we mill it large. So when that shrinks down, things that are important to dentists like margins, the fit, the morphology, the functionality of it is really is profound and it's very precise. We're talking microns of precision here where we don't really even have to adjust the restoration when it goes in.
You have been, you continue to be the standard for teaching aesthetic procedures, as you mentioned. Could you enlighten us a little bit on the acceptance level for aesthetics?
This is where I see things going in dentistry is, first of all, the consumers drive what we do.
Yeah.
And we heard that this morning in the lecture here. And as our customers, our patients, are looking and raising their own expectations, we have to be able to deliver that. So when I think of aesthetics now, it starts with function first.
Sure.
And fortunately, just as we see in other softwares and technologies, the Sirona system has the ability to analyze the mouth from an algorithm standpoint. It has great templates. We have the biogeneric software that can analyze tooth shape and form, which allows you to get a really nice morphological appeal with not a lot of work. In fact, it will outperform the average user now.
Interesting.
Which is mind-boggling. So when I think of aesthetics, I think of form and function first. And with the materials we have today, we have chameleon-like materials.
Yeah. So you have the aesthetics.
So we have the aesthetics. So most of what aesthetics is in my book is form and function.
Yeah.
So it's a lot easier than it used to be when I used to try to match a PFM.
Yeah, I bet. I want to move my questioning to Dr. Patel, if I may, but again, please feel free to
Sure.
join in. First of all, Dr. Patel, I want to thank you for contributing to Inside Dentistry and Compendium over the last 4 years. Thank you very much.
Well, thank you for the opportunity.
Yeah.
I believe this is my 5th article with AEGIS. I had 3 in 3 years, and then I've already had 2 this year. So thank you.
Let's keep this an annual.
Absolutely.
It's a win-win. Your practice is certainly a multidisciplinary approach. Could you tell us a little bit how all these digital tools that are now available to you, how have they helped you with treatment planning across all disciplines?
Well, pretty much the main thing that I'm involved is with CEREC, and I call it the 5 C's of CEREC. I believe what CEREC allows me to do is, number one, convenience. It's great for patients. People love same-day dentistry. They don't want to come back a second time.
Sure.
And what I've experienced is people who get same-day dentistry done are the ones that refer me friends and family. Number two, I believe, is the customization. I just attended Dr. Klim's breakout on aesthetics, and it's so easy to customize your restorations with CEREC versus what I could do with the lab. The communication was just not there. And being conservative, I can prep for inlays, onlays, crown lays, as I may call it, flat preps before I go to complete coverage crowns. Having the control, that's C number 4. having the control in my design options, having the ability to buy a copy or choosing individual or reference for my designs. And last but not the least, it's cost effective. Money is not the final thing, but if all of these helps in creating a great patient experience and it saves my office on the bottom line, that's even better.
Yeah, the one-day visits is certainly the most compelling story. How much, Dr. Patel, is that incorporated into your marketing initiatives?
I'm sorry, I didn't get your question.
The one-day visit, certainly a compelling for the consumer, for the patient. How much of that is part of your marketing initiatives?
Oh, it's everything. I mean, I believe people who come to my practice come looking for the same-day dentistry. I had a patient once. I remember he came in with a broken tooth in the front, and I wasn't very sure if I could get the same exact result that I wanted with CEREC. I was a little hesitant. This was a few years back. And in fact, he told me, if you can't do it same day, I'm headed to the next dentist down the road. And it's pretty much out there. People know about it. They're Googling it. They are on it on the internet, and they come asking for same day crowns.
Yeah, as you said, as part of your big referral system.
Absolutely.
I'd like to open up this question to all of you. Are there any areas of digital dentistry that have surprised you, I guess negatively or positively, as it relates to treatment planning?
Well, I would say for me, the 3D imaging, Tony, has really exploded our ability to see where we're blindfolded. As you know, endodontics.
You can't see if you can't do anything if you can't see it.
You can't do it if you can't see it. And this has enabled us to actually see the inside of a tooth where before we couldn't. So it also helps on treatment planning in terms of teeth not to treat.
Yeah.
I used an example this morning of a broken root, and you couldn't tell by a radiograph. You had to look at it in 3 dimensions.
Yeah. Sure.
And then another instance where the diagnosis would have been wrong had I not had the advantage of 3D, because there was a tooth, maxillary first molar, that had root canal treatment, and then a second time, and was referred for the third time. But the problem was a gouge on the tooth behind it from a previous surgery, and it was a toothache. Right. And it was easy to diagnose once I could see it.
Yeah, you couldn't see that with 2D imaging.
No way, and it doesn't show. I will tell you a quick story. This was last week. John has a toothache. Now, I was thinking I would only ever do endodontics. I was going to save myself from the big diseases, heart and cancer and so forth, but didn't have root canal treatment on my radar. And first, I had tooth was bothering me, so I adjusted the bite by myself. And then I tried to remove the crown by myself because I figured the crown was loose. And one of the staff people said, let's take a periapical, which we did, and it looked fine. And she said, I think, well, I can't diagnose, but of course I think that perhaps we should take a 3D because I think you're in denial. I think maybe you do have a toothache, Dr. West. Took a 3D, and there it was, bigger than life. And the day before I came here, my son finished the endodontics, and I can chew again.
It's a great story.
So it's a personal
Have you
triumph.
shared that story with Amanda at Dentsply Sirona?
No.
You know what I like here? I mean, do you feel his passion right now?
Yeah.
I mean, look at where we are in our careers.
Yeah.
And, I would say, and my CAD-CAM, CEREC is my right hand, but my 3D has been more profound in my practice than anything I've ever integrated, even more than CEREC, because it allows you to look more comprehensively at patients. It helps you to understand form and function. We're developing templates that help us to understand how to restore people and some headaches to look out for, particularly when it gets to functional analysis, jaw tracking, sleep apnea, all these things. And it's changed me as I convey myself to my patients, and they feel it, don't they?
Oh, yeah.
I mean,
I did.
and they raised the bar. And, how can you stay interested? Like I mentioned this morning, I've been practicing 32 years, and I hope to get another 20. The reason why is I'm having so much fun investigating these new technologies and providing better care for my clients.
Yeah.
I mean, it's profound, and I feel very blessed. I'm glad I'm practicing today rather than 30 years ago, because we were talking about that before when we were coming out, is how do you keep your passions alive by improving yourself, and then it becomes who you are as a person.
Yeah, I
Yeah.
recently attended a 3D imaging conference, and some of the lectures that focused on the diagnosis as it relates to helping sleep apnea was incredible. Seeing the issues that are happening with open or unopened airwaves, only diagnosed through cone
Yeah.
beam technology.
And if you get that, I've had sleep apnea since I was a teenager because of just the way my throat is, and it can kill you.
Yeah.
There's something that is not being addressed enough, and we have the perfect system to help investigate that and intercept that problem before it becomes apparent to people.
Yeah.
I think on a much smaller level that goes grossly unnoticed is with all the advancement in the technology, I think the credit must be due to the manufacturers as well with the advancement in materials as well. I mean, I started off with CEREC about 8-9 years ago, and there were not many materials to choose from. But these days we have a lot of hybrids. And with Ivoclar coming up with the MT block, that's one of my favorite blocks for anterior teeth. Now, if they could just give us the multicolored EMAX, it would just be the icing on the cake.
Yeah.
You ask how the technology has influenced our practices, and James, you used the word control. And in endodontics, we were very much out of control since we couldn't see, and this has really enabled us to see and therefore do.
Yeah.
And the other thing that you said, Dhaval, was that single visit. I hadn't really thought about that much, but now that I can see as a restorative dentist, when you have the skills and the endodontic technologies to successfully treat a tooth in completion on a single visit, follow that up with a crown, because that was always a weak point from doing the endodontics. Then they have a temporary, they come back 6 months later, there's decay, and that whole continuum is lost. And that whole single visit, single dentistry, single day dentistry
I own
really
a group
rings a bell.
practice, and that's pretty much what we do when we have our endodontist on board. I mean, the endodontist comes in a couple days a month. We line him up with some great endo cases. He does the endo, I do the crown. He does the endo, I do the crown. That's how it goes all day long. And patients love it because they don't have to go skip between offices, and they get both their things done at the same time. So it's a win-win for everyone.
Sure is.
Another question for everyone. Sirona's a company that truly offers an end-to-end digital solution. What are your thoughts on the next plateau? Where do we go from here?
Well, I'm not going to be content until I can lay on the beach in Maui and do a virtual endo in Seattle.
It's a great answer.
Robotically.
Okay.
Robotics.
But there's a big gap there.
You'll be
we're gonna
surprised.
close it.
You'll be surprised.
Yes.
You'll be surprised.
One thing I like about the digital platform is with digital platforms, you can measure and develop algorithms that will give the clinicians templates to recommend or focus treatment as we go. I see that particularly with function, morphology, and also the skeletal function. My focus in my practice is more rehabilitative.
Okay.
And I've studied for years on how to improve people's lives from a functional standpoint. And now that I have 3D, I'm starting to see trends within skeletal development and remorphing of like the condylar portion of the jaw, where you can look at a patient and almost see where they've been, but it also gives you evidence and a focus on how best to treat people because we can now measure it.
Yeah.
For a long time, we couldn't measure everything. It was philosophy, and I see Sirona. Sirona is such an innovative company. Well, Sirona Dentsply, to put it right, but they're so innovative. I wouldn't imagine where we were 5 years ago. This is a new game. I couldn't even imagine where we would be now with what we can do.
Omnicam. It's a game changer.
And the software that supports it, and now integrating that with 3D. So with our Omnicam and our 3D platform restoratively, we communicate with 3D CAT scans, and that communicates. For instance, when I place my implants, I set up my implant to my curve of Wilson and Spee to optimize force dynamics. I mean, think about that for a moment. And what it does is it provides predictability and safety for our patients. And we sleep better at night. So
You talk about emotional closure all the time. I know you relate it to aesthetics, but I believe that pretty much goes in every aspect of dentistry. You know, before you start any kind of procedure, you want to have that emotional closure and being in control of the final outcome. Like you said, you can sleep better at night.
Yeah.
what you know, I'm getting kind of like pumped right now, but
You want to drill on some teeth?
you know what's so nice?
You could tell. It's good.
You know, I'm married to a therapist, so I kind of look at dentistry through the eyes of the patients and how they feel. And I deal a lot with aesthetics. And so now we can actually design our aesthetic protocol within the CAD/CAM system. We can mill out transitional teeth, try them on before we ever prep a patient.
Right.
And get emotional closure, get functional focus.
Yeah.
I mean, that's the dream with what we do.
And the key to your point, I mean, you've talked about function, predictable dentistry, quality patient outcomes. It all starts with the ability to measure.
And measure and diagnose. And so I think that package is communicating now, and it's moving so quickly, it keeps me on my toes.
Yep.
Yeah.
A few questions for you, Dr. West.
Sure.
I told you I wouldn't let you down. As an endodontist, I want to first ask you, how are you enjoying SIROWORLD? And what would you want to share with your fellow endodontists in terms of why they should be at this meeting?
Well, first of all, I'm learning a whole new language.
Yeah.
These are big words for an endodontist. The thing that really strikes me, Tony, is the energy here about the excitement of rejuvenation. I'm just starting over as a child, a kid in a candy store kind of thing. But what strikes me is we are at the knee of the curve. And it's not like we're going to continue now linearly. It's going like this.
Yeah.
So instead of we're talking about things next year, we should be talking about things next month. So the big thing with the endodontist is we have, in my opinion, lost our place in the world of dentistry. Some of the major meetings have very few endodontists. They don't feel included. They're not included. But it's our job to make ourselves included and make our skills known, but know how it fits in the entire treatment plan.
Yeah.
So I will be a great advocate for Las Vegas and points beyond.
Your comments are so interesting because I've had the opportunity today to interview a handful of dentists and CIRAC trainers, and it's just, I compliment Dentsply Sirona so much because it's such a community, and how they engage and how they foster that sense of community is really brilliant. And I asked a few of the Sirona executives, what are you doing after a sale is made? What are you doing after this program to continue to foster this sense of community? Because it's really tremendous. Yeah. Everyone loves peer-to-peer influence. Everyone wants to hear what their fellow clinician is doing. And to come to this type of program and hear other CIRAC users talk about patient outcomes and their successes is really quite extraordinary. And so I find it interesting that one of your comments is the passion, the excitement here. It is really, truly a different type of program.
And to me, the real value of the merger is MyFair was always a stellar company, but also we were a stellar company, I'll say we, being part of it, at what we did.
Sure.
And we weren't snubbing our nose at the rest of the world. We just weren't part of it. This is a great way for endodontics to join back in the world of dentistry.
Sure. Are there any new educational tools for endodontics, whether it's local type events, hands types events, or large events, any sort of component that you've seen here at SIROWORLD that you think would be very effective at a purely endodontic type of program?
Well, if you go to DensplySirona.com, you're going to find a good start there from an educational point of view. And if you go to chairside.com and endomatters.com, those are updated constantly by Dentsply in terms of education. They're very fresh and highly educational. A lot of general dentists reporting in on these cases and patient treatments and so forth, techniques and technologies and tools.
Yeah.
So that is the very best place, and I'm still opening my eyes as far as the incredible educational opportunities that I think will be available for endodontics, but I can't put my finger on it just yet.
All right.
But give me a few
You'll be on the
months.
panel next year, and we'll talk
Report
about
back.
it. Yeah.
Update it.
There you go.
3 minutes. Just a last question for me. If I could get a comment from each one of you, what do you hope to leave here with?
I love the companionship of like-minded people. I mean, I get excited hearing you, Dr. West, and your passion. And I mentioned this early, momentum is really important, and your momentum defines how you think and make decisions. And what I see when we come to events like this is that you'll hear someone or you'll meet somebody that will put a pearl into your brain, and you'll go home and you'll think different the rest of your life. Those are moments of clarity, as Paul Homley would say.
Yeah.
This is an event of moments of clarity, and that's what I'm going to.
Well said.
Yeah.
Dr. West?
What strikes me, Tony, is 5,000 people. I don't know if it's 4,000 or 5,000. Extraordinary companies, great thinkers, people like Dave. But there's one person that's not here, and that's our patient. And but it's clear that they are here, and it's very, very rewarding for me to see the heart of our efforts don't have to do with us. They have to do with that patient, that smile, their well-being. So it's been very powerful for me.
Terrific. Dr. Patel?
I think meetings like these, what they do to me is inspire me. I go back to CEREC 27 and a half. That was my first CEREC meeting. And I got inspired by Dr. Klim and Dr. Scramstead, Dr. Agarwal, Dr. Puri. These guys are the stalwarts in within the industry and the technology. And that kind of started to inspire me and has seen a huge growth in my career in terms of my dentistry, my speaking career, my teaching career. And, I'd like to thank each one of them, and as well as Dentsply Sirona, because as a company, they're very nurturing and they make everybody grow together.
Fantastic.
Yeah.
Thank you all for being
Thank
here.
you.
Dave, thank you.
you.
Congratulate
Thanks, Dave.
Dentsply Sirona on another great event. Thank you.
And I'll tell you what, I love listening to you guys because this has been the most passionate panels I've seen yet. And that's one thing I love about you guys. You're just passionate about your job, learning the latest technology, but putting it to work for the patients. And I love that. Tony, great interview.
Thank you.
You're awesome.
Thank you very much.
All right. Enjoy the rest of the show. And we're going to take a short break, back with more at SIROWORLD 2016 right after this.